name is Jessica Nixon, Administrator for the Friendship Home in Audubon. I'm reaching out to you today on behalf of the Friendship Home to share with you some of the experience we've been having as a facility in long-term care during the COVID-19 pandemic. In particular, I'd like to visit with you about our decrease in occupancy and the impact that that has had on our ability to operate as an organization. Across the state and across the United States, long-term care facilities are seeing a significant decrease in occupancy due to COVID-19 and the fear that surrounds going into a nursing facility and residents and families being able to have access to one another and to potentially mitigate the risk of being exposed to COVID-19 in a facility. Now, I will be the first to say my heart goes out to anyone who's experienced COVID-19, has lost a loved one, or who has experienced an adverse experience with a long-term care facility during this time. This has been difficult for the facilities to mitigate the risk for exposure, get their arms wrapped around a exposure and an outbreak, and I want to commend our partners in the sector who have had an outbreak, mitigated it, and have recovered. That is no small feat. Furthermore, I also commend our partners and our own organization on the efforts we have made to keep COVID-19 out of our building. We have focused efforts on early testing, on making sure that staff are trained and equipped with proper PPE, and that our families understand how important it is that we practice the rules, regulations, and precautions offered to us by the Departments of Public Health, CDC, and our regulatory bodies, Department of Investigations and Appeals. The impact of COVID-19 has not only been the outbreaks, but as I mentioned before, driving down occupancy. When we are in low census, even in good times, it inhibits our ability to stay operational. We, as an organization at the Friendship Home, have been determined to protect jobs and protect the safety of our staff and our residents. In doing so, the additional costs to maintain staffing, to procure PPE, to source things from food for our residents, to paper products, toilet paper, paper towels, so on and so forth, has been a new level of challenge that we could never have anticipated. All this being said, the Friendship Home finds itself in a very vulnerable position in the months to come. We are optimistic with the production of vaccinations that we will be able to protect the most vulnerable by giving them access to these vaccines that could protect life. So, the Friendship Home needs you. We need our community. We need to hear from you. We need to know that we are valued and that we are needed and that you back us in our need to sustain operations. We have sent out recently our appeal letter asking for support, detailing the cost of some of the upkeep and improvements that we need on our building. But recent events have brought us to our knees, and we acknowledge that now is the time to ask for your support in keeping our doors open, in keeping our facility available to our community members, available as a resource to caregivers and care receivers. We are here for you. We have focused our efforts all throughout this pandemic using the federal and state aid that we have received to backstock our PPE supply, to be able to take on admissions and continue work forward. None of us could have anticipated the impact that something like a global pandemic would have in so many ways. We understand that our businesses in our community have suffered due to the impacts of COVID-19 and shutdowns. This does not come as an easy ask for us. We want to be strong for you. We want to sustain. We want to be what you need us to be right now. But that does require your support. We ask that you consider making a donation, that you sponsor ads, that you help us be part of getting the message out, like I am today, on the positive impacts that long-term care facilities have on the economics and the commerce and the strength of rural communities, rural health systems, and the elderly we serve. We hope that in the months to come, this will be abating, that we will be seeing the end of this virus, or at least improvements, so that recovery efforts can begin. We are optimistic as a leadership team that we have the infrastructure and the ability to grow and to sustain. Early in 2020, we were reaching a 50 census, which would be approximately 80% occupancy and capacity. This was great. We were ready to take on the task of going for quality awards and for the accolades that come with all the hard work that we had put in before the pandemic. Now our focus is on survival. Surviving something that is so far out of our reach, so far out of our hands to do anything about. We are vulnerable to the reimbursement from Medicaid and Medicare services and insurers. Operations are down. Folks who need elective surgeries and would come to us with skilled referral requiring help to get stabilized so that they could return to home are not able or unwilling to take the risk of doing those procedures. We see that impact. We see the reason why. We understand the why, but we're hopeful for the future. We're hopeful that you will come to us in our time of need and help us to prolong the life and longevity of the Friendship Home. If you have had a response to this message, and if you'd like to know more about the Friendship Home, about our experience, or if you are looking to make a donation, please reach out to us today at marketing@friendshiphome.com, friend@friendshiphome.com, or social services @friendshiphome.com regarding donations, placement inquiries, or just general information on how to help care for our elderly and vulnerable in our community. When this is all over, I hope that we can all celebrate as a community and an organization in our ability to protect the most vulnerable during their weakest hour in this global pandemic. God's blessings. Thank you very much.